All right, it is the long-awaited Thursday here on Coronavirus Inside the Numbers here in Arizona. And the reason we wait for Thursdays is because new information comes out on a weekly basis, although we talk about it every day right here and give you all an inside scoop. On Thursday, it's the day the state releases more specific information on reopening of schools. We are delighted to say that 4 counties have reached those benchmarks of the 15 here in Arizona. We will get to all that. In fact, we'll start with all of that today. But before we do, I will mention that here in Arizona, we are approaching 196,000 cases. We had 723 added today. And as far as lives lost here in Arizona, more than 4,600 for an exact total of 4,684 people, an increase of 50 reported into us today. So normally we start you all off on the summary page, but we will start with these school benchmarks because we know how important it is to so many of you. And if you are in the comments, let us know where you're watching from. Let us know where your kids go to school or your grandkids go to school, and we'll help to get you the information from that as well as we walk you through all of it. Garrett, we just heard from the governor just minutes ago, and he was talking about a ton of stuff that we'll talk about here, but let's get to those school benchmarks.
All right, let's go right to the school benchmarks. First, we'll look at the page for the school benchmarks. This is basically the PDF sheet that they give us to say, what people are making here, which counties are making it. Mm-hmm. So these are the 3 criteria. As you can see, cases either need to be a 2-week decline in the number of cases or a 2-week of case rate of less than 100 cases per 100,000 population. The percent positivity must be under 7%. And the COVID-like illness, which is the CDC's surveillance system that sort of looks at inpatient and emergency department visits and determines what the symptoms are and what the COVID-like illness would be in that hospital, that has to be below 10% within the region. And there are 3 or 4 regions. It looks like there's 3 regions in Arizona here. So here we are. What we have is Apache County. Once the biggest hotspot in Arizona during the very beginning of the pandemic has met all 3 benchmarks. Cochise has met all 3 benchmarks. Coconino has met all 3 benchmarks. And then Yavapai County has met all 3 benchmarks. So 2 northern Arizona counties and 2 southern Arizona counties have made the benchmarks. Did I say 2 northern and 2 southern?
You
did. I
did.
get that right? Okay. Oh, and Green. Did I? Okay, sorry.
4 total. So Apache, Coconino, and Yavapai. So
3 northern and 1 southern. Sorry about that.
Yeah, so they'll be able to offer in-person learning if they would like to, if their schools are ready for that, as well as a hybrid version, so that parents and families can still make the decision on their own, but that schools in those 4 particular areas are now cleared to provide both of those learning opportunities for folks. How close are we in some of those other counties?
We're going to jump right into the schools dashboard. Like I said, everything was updated today, so we've got some news here. So we're going to go right to the dashboard. This is it. This is an AZDHS dashboard. Right now, we're looking at the state numbers, and you can see that the state in and of itself meets 2 of the 3 criteria. They do have had a case decline. They also have a under 10% CLI number, but we're still above 7% on the percent positivity. But let's look at those counties. So we'll start with Apache County. You can see that Apache County has met the declining cases. They do have they have a higher than 100, they have 190 cases per 100K, but they do meet that declining cases, and it's a pretty drastic declining cases as well. And again, this data is from August 2nd, so we're still looking about 13 to 15 days in the past. Here we are with the benchmarks. You can see their benchmarks for the weeks of July 26th and August 2nd are both under 7%, 6.3 to 4.8. And then the benchmark for the CLI is low too. We'll look at Coconino County. Coconino, same sort of situation. In fact, they are both under 100K per capita and declining cases. So they make both criteria there. You can see they have a slight increase of percent positivity from the 2 weeks, but it's only slight and it's well under the 7% threshold. And then this right here is the CLI. And then we'll go to Cochise really quick. and show the same thing. You can see that they are under 100K. However, they did have an increase in cases in August 2nd on the actual raw number of cases. And then here you can see they did make the benchmark, and they also made the CLI. So let's look at some of the other counties. We'll start, of course, with Maricopa County. You can see that Maricopa County already meets the decline in cases. And right here, we're also under the 100K per individual. So right here, we're at a rate of 50 per individual. So we're near there. And then right here, the 7%, this is where Maricopa County is failing right now. We're at a 9.4% on, we have not got to that 7%. And based on that 9.4, it's likely that Maricopa, it's going to take 2 weeks for Maricopa to recalculate into the moderate or into this zone where they are, the gating criteria has been met. The CLI, you can see, has also been met here. Let's look at another county. We'll go with Pima County, of course. You can see Pima, large drop off in cases, very close to the percent positive, but still over, and the CLI is in there. So Pima County is in the same situation where it's going to take at least 2 weeks simply because they're not calculated even 1 week under that 7%. So that's sort of where we are with the counties right now. Coconino, Apache, Cochise, and Yavapai all can basically they have the go ahead to open up their schools to at least some in-person instruction.
So we want to remind everybody that this particular page that we're looking at comes out with an update every Thursday. So if you were checking it religiously every day, it's not going to change. They're reassessing it on Thursdays. And then, Garrett, we have an even more specific map for those of us in Maricopa County. And that detailed map that takes us down right to school districts, right to zip codes, that will be updated later this afternoon. So we'll wait patiently for that, and likely it will come after we're off the air here. So we'll have a lot to talk about tomorrow based on that. But we want to distinguish between the two numbers so that everybody understands where those are coming from and how the timing is a little bit different. Vanessa's asking, where's the link to this map? Vanessa, the address was just up there on the screen a second ago. Producer Josh putting it back up for you. It's azhealth.gov/schools COVID-19. So on that very first page on the Department of Health site, they've got a little icon for schools. You'll want to click on that instead of going into the data right away. You'll be able to see that on there. And then Vanessa, if you wanted the larger look at all the counties, I'll let you guys know I put that on my everywhere, Instagram, Twitter, Facebook. I put it on all my social media accounts. Since you're on Facebook right now, many of you watching on here, I'll let you know what my Facebook address is. It's facebook.com/news from Katie. Vanessa writes, thank you. Vanessa, you're so welcome. That's why we're on here, just to help everybody get the latest information. And we go through these websites all the time. So any way that we can make it easier for you to get to the info faster, that's why we do this each day, so that the websites that Garrett and I are used to staring at where we can find things faster, we're happy to help. So thank you, Vanessa, for the question.
Some people were asking for some other counties, so I'll just go through them very quickly. Yuma County, you can see the percent positive for Yuma County is still very high. It's going to take a while for Yuma to get down to that 7%, at least 2 more weeks, obviously, but perhaps a little bit more. Pinal County was also requested. Similar situation in Maricopa County, likely recalculated under the 7% by 2 weeks from now or so. And then we'll go to Gila just because it's in central Arizona as well. You can see also Gila at least 2 weeks simply because they haven't met the 7% for anything. So that's sort of where we are with those counties. And then we can also go to the work and business dashboard as well if you want.
Yeah, let's do that. I see one question that's come up. Yes. Jennifer is asking, can someone please help me understand what the cases reported today includes? Positive cases from prior day reported, presumptive positives. I feel like I understood it, but so much has changed. But Jennifer, that's exactly why we want to help everybody understand this. So these are reported today, but then we'll plug them back in on the date that they actually took the test. So when there was that delay in testing that was lasting 3 weeks, although they were reported on that day, they were plugged back in to the day the sample was taken so that we can really understand the curve of this. Now, the good news is that these test results are coming back much faster in a matter of hours and days now instead of days and weeks. So although we say cases reported today, that's because some were from yesterday, some are from a couple days ago, some are from further back. So that's just the correct terminology to use, but we're plugging them in based on the day. And hey, Jennifer, the good news is that we're pulling these numbers down under 1,000 finally. Garrett, I think we're on day 7 now of under 1,000 cases reported in each day.
Yes,
so
we're on day 7.
Really, really helpful news in all of this. I know that we here we're watching some of these ER numbers as well. Today it was stabled out a little bit. It was a little more as expected without a bump.
Yeah, we'll go through the hospitalizations, but yes, we're seeing hospitalization, especially the ER. The ER has been leveling off more so than any of the other hospital assets. They're not going down, but they're not going up. It's just sort of leveled off right now, which again, we talked about with an ER, we might be sitting at a floor, and we've been seeing everything sort of slow down. Cases, tests, we've seen inpatient, ICU, everything's sort of slowing down. It's been going down so quickly, and now it's slowing down, not going up, just slowing down. So, that might be what we're seeing with that emergency room visits, is we're just seeing sort of where we were looking at, where, this slowing down of the curve.
So it's almost like, for lack of a better term, like a roller coaster, and you've gone down the dip, and now you're just coasting back into, where you're loading onto the cart, if you will.
Yeah,
so,
and I can show you that momentarily. So I've got, to answer that question, I've got the curves up, and I'll take you through them really quick.
Okay.
Right here, this is the case curve. This light blue is what was added today. And you can see not a whole lot added today, and that's normally how it is, but you can see it was almost all added before this 7-day cutoff where I stopped the yellow line, which is typical. So all these cases were sort of added where they were supposed to be. There are a couple up here. You can see there was some data entry being done to sort of add some things here and there, but not a lot of cases. This is what it actually looks like as far as the amount that were added and deleted over time. The vast majority coming in the last 2 weeks, and then some adjustments here and there. Cases or tests, excuse me, very similar situation. In fact, that's why I think that there was data entry in the cases today, because you can see with the tests, they almost all came in the last 5 days. Here's that. There was no tests added prior to August 9th. And then everything else was just test corrections, probably deduplications. Almost all of it was right here. And then for the deaths, this light blue, you can see we're still in a situation where there's a lot of research going on deaths. You can tell we're still getting deaths being added to the curve all the way as far back as June and early July. And so that's just what's happening right now. As it appears a lot of examination going on. You can see it right here. This is showing that there's still deaths being added even as far back as April, but the examinations really start on July 20th and forward. And then I think for emergency rooms right here, it might be, so you can see this pretty well. So you can see this purple line is the emergency room visits, and this is the assets that were available, emergency room beds, available emergency room beds. And you can see it really did slow down, but then about right here, which is about the middle of August, about 7 or 8 days ago, you can see it sort of slowed down, and now it's sort of on this, it's not really an upward curve, but it's sort of this flat line now at this point.
Yeah. Okay, I want to continue with some more of the comments. First of all, Lou, thank you so much. Lou just wrote, you guys are outstanding. Great job. Thank you both. Thank you, Lou, for saying that. Lola had a question about the website for the schools and the benchmarks. I hope that you got that, Lola. Post again if you didn't get that site. I'll make sure that we add it up there one more time. Let's see. Oh, there. Thank you, producer Josh, replying to Lola there. So she's got the answer. All right, you were saying some of the other benchmarks, Garrett?
Oh, yes. Let's go through the other benchmarks because we have 2 separate gating criteria, of course. We've got the ones for the schools, and then we have the ones for the businesses. They use the same methodology, but there's slightly different way that they're interpreted. So, and we do not have a situation in which some of those counties that are available for schools are not available in the moderate status quite yet. And I have that opened up right here. Let me reload it so it goes to the state first. And here we are, the state. You can see the state is still classified as substantial spread. But really, if you look at this, this is likely going to be the last week in which the state is classified as substantial spread. We are at the 10% threshold from July 26. And also here in this July 26th is over 121, but the August 2nd went down to 50 per 100. And we already know, because we've already gone through this week and this next week, that number continues to go down. So next Thursday, when we're talking here on this this Facebook Live, we are going to be in a situation where the spread for Arizona itself will be considered moderate. So let's go through some of those counties that already basically got through for the schools. Well, not quite, because they have a separate criteria. They don't allow for just a case drop for businesses. It has to be this per capita number. And you can see Apache County still at 148. They're at 40. And it appears that once next Thursday, Apache will be reclassified as moderate. But as of today, it's still considered substantial. Coconino was given the moderate go-ahead today. So businesses in Coconino can now start applying for reopening permits and are able to take in the number of people that are allowed. I think for like gyms, I think it's about 25%. We'll go through the criteria of what it is, but what they're allowed to do. Yavapai, as we talked about, was moderate last week, and they maintain their moderate status this week. Cochise was moderate last week, and they maintain that status. Maricopa County, not quite. It still looks like Maricopa County will be ready and will be in the moderate status next week because of this right here and this hang up right here. Once these two are cleared and this is recalculated next week, we should be in the moderate status.
Let's see. Jennifer just asked about the tests at ASU. Are they being reported? Yes, they are. She's asking, are ASU tests counted? So the kids who are moving into the dorms took tests. By the way, ASU starting back in person for learning today. Those are reported to the state. Although I think where the confusion, Garrett, came in on this is when ASU said, we're not going to report just ASU-centric numbers. And so so people thought they weren't going to report the numbers. They're still reported to the state. They're still in the count that we're passing on to all of you. They're just not putting those numbers out.
They're not putting out a dashboard for ASU saying this is what our numbers look like on our campus. They're not doing that, but they are reporting everything to the state.
Yep. And that's a good question. I think that's where the confusion came in on that for so many people, because we got that question a disproportionate amount of the time, and I think that might be why. Let's see. You were talking about the reopening of restaurants and bars and places like that. We can tell you that 800 applications have come into the state. And one of the things that the state let us know that they're really looking for is these businesses going above and beyond what they have asked of them. We know that of the 800 applications that have come in, and by the way, if you're interested in the full list, it's over on abc15.com right now. 38 they have said yes to, and 100 have been denied. So they're really looking for these businesses to not only do the things that they suggested, but perhaps come up with a few things that they're doing to keep their clients and their staff safe as well. And that's one of the things that they're looking at as they review these cases. So if you want to take a peek at the list, once again, it's over on abc15.com.
And Elizabeth, ASU is reporting electronically. They've been reporting electronically since day one. So that was something that they told us once ASU. In fact, ASU began reporting during the lag when we were all talking about this massive SonoraQuest lag. All of a sudden, these tests started to pop in that were being processed in 24 to 48 hours and sometimes 36 hours. But, we asked them about this and, what are these tests? And they're like, oh, that's ASU starting to, ASU came online.
Mm-hmm. Yeah, and if you're thinking about going to get a COVID test, there's a site set up that you can look through, see which area is closest to you, which type of test you would like to get. The address is right there on the screen. Do I need a COVID-19 test.com? That will direct you to both a day and time and location that work for you to get the test done. And ASU, you can sign up at ASU through that as well. They're doing the saliva test, so that's what you need to look for. What is the benchmark? Rosalind asks, what is the benchmark percentage for schools to go back? So 7%.
Yeah, it is. The three benchmarks are a decline in cases week per week, or a less than 100 cases per 100,000 individuals for 2 consecutive weeks. They have to have below a 7% positivity on their diagnostic tests for 2 consecutive weeks. And then they have to have an under 10% on the COVID-like illness for quite some time. The COVID-like illness, all counties are making that benchmark. That is no longer an issue in this state. There are some counties that are still not making the first 2 benchmarks at this point.
Yeah. Greg Hausner asks, will churches be open next week? So Greg, churches are allowed to be open. They were never shut down. What has been discouraged is people getting together in large groups. So for churches that have decided to go online or stream their services, it's to keep their parishioners safe, the people coming into their churches safe, and they've made that choice instead. So they were never forced to shut down. It's up to each church or each congregation and how they want to continue to offer their services. Let's see, lots of good questions today. Thank you for all these. Thank you for taking time with us. As I always mention on here, we are not here to make decisions for your life. We're here to help you find the data that you're looking for, maybe your child's school district, maybe a gym in your neighborhood, the zip code that you live in. However we can help you find the information. As I always say, I've been reporting on this since January 17th. Garrett's been staring at the numbers for longer than any of us could ever imagine, more than he probably ever dreamed or wanted to. But we benefit from that in that we can get the information to you very quickly and help you find these numbers. So thank you for spending time with us on here today. Let's see, Nashi writes, are we in good shape with COVID-19? Are we in an increase or a decrease? Right now we're in a decrease, but we're stabilizing in those numbers. So while it's better news, we rode that peak and are thankfully coming down the other side of it. Now, if there's a second wave, something like that, obviously that's what we have to be prepared for, and that's what we heard the governor talk about a bit as we discussed the situation with the flu and what it's going to be like as we hit flu season. The flu shot already available to some, and that being a concern for overriding the hospitals and our healthcare workers once again if these 2 things hit at the same time. So that's a big concern.
Yeah, I mean, I'll bring you to this interesting dashboard. I don't use this that often, but I do talk about it a lot. So we're going to go to the COVID-like illness surveillance dashboard really quick. And this is basically showing you, this is the surveillance algorithm that checks the hospitals for symptoms. And you can see it's got percent of visits from inpatient and then also from emergency room. And we are, as far as the emergency room, we're at 2.9% COVID-like illness. That is less than what we've ever had from when we started to actually monitor this, when the CDC began to monitor it right now. It's as low as it's ever been. As far as the inpatient, 4.1, not quite as low as it's ever been, still, but still lower than it has been since March. This is why we're saying that where we are right now, it's interesting. I don't see it going down much faster. It will likely continue to drop for a little bit, but it appears that we might be hitting sort of a slowing of this drop.
Mm-hmm. Garrett, Dan was asking about Navajo County, and it's reminded me that we could now go back to that summary page that we sort of skipped over in the beginning just because we had so much pressing news because it was a Thursday and those school benchmarks coming out. But if Dan, if you can hang with us for a second, we'll go to the summary page, show everybody what it looks like for Arizona, and then specifically click on Navajo County for you to get you more details.
Yeah, so I'm ready for you. We've got, here's the summary page we talked about today. Still under 1,000 cases, 50 deaths reported today. But as we talked about, a lot of this stuff comes through, there's a lot of data input and data entry going through here. Many of these were not reported in the last week or two. We have a dropping percent positive. 7,000 PCR tests were reported today at a 3.3 instead of a 3 point. That's the cumulative. It's now at 3.3 instead of 3.4. The serology hasn't changed. It's 6% cumulative. Interestingly about this, though, is a lot of these serology tests came early on. If you look at actually what the day's serology tests were, it was closer to 14-15%. And the PCR percent positive is closer to about 6% today.
And what about Navajo County for Dan?
I don't have the PCR. I don't have the electronic reporting percent positives for any of these counties quite yet. You can see not a lot of action in Navajo County. A lot of this has to do with the fact that a lot of these tests, the Navajo County don't come to AZDHS. The negatives don't. They go through Indian Health Services, which does not go through the. We get the cases, but we don't in Navajo often because there's so much of the Navajo Nation over there. So you can see only 75% reported today, only 8 cases, and then 1 reported death. And it said a lot of those are Navajo Nation cases, but the Navajo Nation has slowed tremendously.
Yeah, so each of these counties report differently and provide different information to Navajo County. And well, I should say specifically, the Navajo Nation is reporting recoveries, and we're not getting that from other places.
No, that's exactly right. That's one of the issues is we get there's these different data sources. Yeah. Navajo Nation gets it from different places, but only reports certain things that happen in southern Navajo County. The AZDHS does produce some of this information, specifically the cases and the deaths. Sometimes it takes a little longer to get it from the Navajo Nation, but they eventually kind of get it and get in there. But we do have to observe like what the Navajo Nation says and what their data is, because they produce this data differently, and it takes a little longer for it to circulate into the state numbers.
So, Garrett, later this afternoon, we're hoping that those more specific maps from the county will be updated. We'll already be done with our conversation here within the next 15 minutes or so. But I wanted to show everybody, for those who are interested in the numbers that are going to be coming out this evening, where they can find those. So where they can find that specific map from the county, where if they're interested, maybe after dinner tonight, they can take a peek at their neighborhood, at their zip code. We'll, of course, walk you through it all tomorrow as those numbers come out. But can you show them where to find that?
Yes, it is on Maricopa. It's on Maricopa's COVID-19 page right there, maricopa.gov school dashboard. I have it pulled up so you know what you're looking at. It'll say school reopening dashboard and guidance. And you just scroll down here and it gives you unified school district, elementary school district, high school district, cities, and zip codes. And like we said before, we were waiting on this to be changed. It has not changed yet. I was hoping that because we saw numbers from the state change, that we would get new numbers on this today, but it didn't happen. So we'll be watching this tomorrow morning, and we will have some really interesting information here as to which school districts do flip into the moderate category tomorrow, as well as which zip codes and other things.
Do you anticipate we'll see a big change?
In the zip codes, I do believe that we will see some significant changes in the unified districts. I believe that most of the, like we've talked about, Queen Creek will likely make moderate status tomorrow. Chandler will likely make moderate status tomorrow. Most of the East Valley, it appears, will probably make moderate status. Gilbert, so this entire area should go yellow. Mesa will likely not. It'll still stay red. But essentially, you're looking at an entire, and we've talked about this before, how, the way that COVID-19 has impacted communities it's really hit communities that are sort of the less wealthy communities harder than it has in some of the more wealthy communities. If anyone knows Arizona, they know that this area, for the most part, is generally more wealthy than the west side of Phoenix. And you can see this sort of is reflected in these numbers. You can see this, all of Scottsdale, Fountain Hills are in moderate already. The East Valley, Gilbert, Chandler, East Mesa, all of these areas are going to be in moderate tomorrow. These are very wealthy suburbs. But if you look over here on the west side at Dysart, for example, Dysart still has several weeks to recalculate. We're going to see tomorrow what they look like. It's more difficult to predict this, which is interesting because with these state and county dashboard, it's quite easy to predict what's going to happen next week. This one's much harder to predict. So I'm just as sort of watching this as everyone else, trying to figure out what's going to happen next. So, Dysart may be in a situation where they at least have 1 weekend or 1 week next week will be in the yellow. We just don't know yet. And so that's sort of where we are and looking at elementary school districts, we can sort of see the same thing. None of the elementary school districts are in the yellow right now because most of the elementary school districts are closer to downtown Phoenix and on the west side. Yeah. So we'll be sort of watching this to see if any of these make moderate tomorrow, and of course we will show them when the data is calculated.
You really see how equality is a big issue in all of this, and how this is really shining a bright light on what needs to change across the board for folks, and why we continue to give a voice to those people who are in a situation where you're in a neighborhood where it's red and there's no sign of it turning to a moderate category anytime soon. So this is really about equality.
I spend a tremendous time looking at the per capita household incomes of Maricopa County and the certain regions of the area. And if you look at this zip code map on what is red and what is yellow, it's pretty easy to look at it and say, if you spend a lot of time with this and say, the household income of the majority of these moderate zip codes are well above the median income in the state. Right here, Paradise Valley going all the way up to North Scottsdale, these East Valley districts, Ahwatukee, but only Ahwatukee on this side, a little bit over here, which is sort of, this is a very nice area of Tempe right here. And then these ex-urban districts of North Phoenix, but essentially those are the fairly wealthy parts of Arizona, of Phoenix, and the rest of it, you're looking at either very middle class or lower income areas of the valley.
I'm curious if there are any teachers watching right now or any educators, because what we were hearing from a handful is the reasons they were calling out was they were getting to the schools and there was not enough cleaning supplies. There was not enough gear there to protect them. So it wasn't a matter of they didn't want to be there or like they literally did not have the supplies, a concern I think anybody would have if they were showing up to their workplace and the workplace was saying, you need to be here. Here are your supplies, split them up, take one wipe each and figure it out.
And of course, we don't know where, teachers coming in, yes, we see the district itself may have a moderate spread, but we don't know where the teachers are coming from. They may live in other areas that are substantial spread, and they may be taking care of people at home. There's a billion variables. That's the problem with all of this stuff is there's always something that's a variable, and it makes the decision making very difficult, and I don't envy that. So
yeah, we feel for everybody, and as being parents of school-age children at home, we know how difficult it is for everybody. All right, let's see. We're running up on our time and not having a ton of time left to answer all the questions. I know Morgan had a comment just a minute ago, or a question on the Higley School District. That's going to be the best place to check for that information after about 5 o'clock today, Morgan. So if you get, I see all those cute kiddos on your picture there. If you get the kids to bed and get a minute, peek at it. Because it should be updated at that time, but also we'll go through it with you at this time tomorrow if you happen to get a chance to join us on there as well. And there's the address for the school dashboard so that you can set it down. Sherry's writing, I'm at a school and 50% wear masks. There's some social distancing due to low enrollment. Yeah, so that's been the concern. If everybody's masked or not, and everybody's taking precautions there. So.
And I see Brenda's taking issue. Brenda Gold's taking issue with me generalizing the West Valley as low income. I totally get it. I don't mean to sort of generalize the entire West Valley, but I'm just saying when you look at sort of the East Valley to the West Valley, there is a disparity in most of the areas of the West Valley to the East Valley. There are pockets of lower income areas in the West Valley that simply do not exist in the East Valley with the same veracity. It's just not, there's a couple places in Mesa that have low income and maybe places in sort of middle Chandler, but for the most part, the East Valley is a fairly wealthy area as far as household income compared to the rest of the state. Really, it's not even the county; it's the rest of the state. So,
and this is about fighting for equality for all. It's just reflected in this when you're looking at a pandemic and you're looking at this situation that you're able to see the disparities, that digital divide that we talk about, and how income affects all of this, how multiple generations living together affects all of this. It's all of those things that where the conversation needs to continue so that there can be equality for folks, so that everybody gets on the same page of this. So yeah, not to dive into that discussion too much, but There are parts of the valley that have money, and there are parts that don't. And when you're looking at things generalized, just as we have to do at the graphs week to week to take out some of the anomalies, this is the same sort of thing. This is about getting quality care, quality testing, fast testing for everyone, equal schooling for everyone, so there's not a digital divide. All right, let's move on to some of the other things as well. A lot of people were asking about the faxed in numbers, and we heard that Dr. Sunshine, or actually Dr. Christ just addressed it a minute ago, and she was talking about the numbers that are faxed in as well versus the numbers that are coming in electronically. She talked about how statistically insignificant those numbers would be of the faxed in cases. So when we're looking at 1.3 million test results, Garrett, it is possible that we're getting a very good snapshot without having those faxed in numbers, the data entry put in there quickly.
Yes, absolutely. I mean, when even I still have some issues with the AZDHS on the dashboard. I'm waiting for them to sort of answer some questions about those those non-ELR tests, and sort of the reconcile some of the numbers, because every once in a while some of the numbers don't really make that much sense. But for the most part, though, the ELR numbers do represent at least 70 to 75% of the tests that have come in. A much larger sample than most people would need to sort of make a determination. We know that it's not like this targeted community. If that 70, if those 1.1 million PCR tests were coming from, say, hospitals or from long-term care facilities or something else, or say from a certain, so we knew that certain whole regions of the valley or counties weren't reporting, that would be a problem. But generally, the distribution of those 1.1 million tests are coming through the community and coming through nearly every county the same. So we can be fairly comfortable that even if they took and they inputted all those non-ELR faxed in results, that it wouldn't adjust the percent positive by a significant amount. It will adjust it, of course, but not by like 10 points or anything like that.
Right. Brenda writes, it's about people having good judgment and wearing masks and washing hands. Thank you both for giving us the dashboard info. Brenda, you're so welcome. Hopefully we answered your last question, and thank you for leaving thoughtful comments on here as well. We appreciate it. Let's see, there were a couple last things that I wanted to get to, Garrett. One note, and we don't need to necessarily go to this site, but the R naught stayed at 0.84 again today. We did not see the movement in that with a range of 0.64 all the way up to 1. A lot more states, I should say, joined us in the green. We'll continue to watch that after that latest dump of numbers sort of maybe skewed it a little bit. Maybe it'll leave it the same. We'll be tracking that throughout the next week to keep all of you updated. Also, within the next week, we'll likely be hitting that 200,000 case mark here in Arizona. So,
thankfully, though, it took us a lot longer to get there than it used to take us to get.
Yeah, it sure did. I mean, now that we're under 1,000, and then we have the weekend reporting coming in, it's not likely that it would be.
We were doubling back in July. We were doubling our death number every month.
I mean, we would have been. You're absolutely right, Garrett. In July, if we were at this point, we would have been about 200,000 tomorrow. We would have had one day. Yeah, 300,000. It's just, it's wild.
And we've been sort of putting along to this number for a long time. And so that's a good thing. We want that. Absolutely.
Absolutely.
We want to cross these milestones.
Yeah, for sure. We had a couple. Thank you, Amber. Amber writes, thank you kindly to both of you for going over the numbers each day. Thank you, Amber. And thanks for joining us on here. We see your name pop up often, so we appreciate that. ASU is back in school today, so we have a reporter over there, of course, to kind of show you how things are going, keep you updated on that. We mentioned that ASU is reporting the numbers to the state. That was a question that came up yesterday, too, so I want to make sure that you all know that. And then we had a question yesterday that we didn't get time for. I believe it came from Kimberly yesterday, and she had asked, what's going to happen to kids who test positive? There are some isolation dorms so that they're able to go stay there. And, I don't know if any of you who are listening on here or watching on here lived on campus at ASU, but I was talking to friends yesterday who said, remember when somebody got sick on ASU, the whole floor was sick right away. So that's going to be the big concern is then moving anybody that tests positive or feels sick out of that area into some sort of isolation area so that they're not, getting everybody sick from this. So also North Carolina, yeah, Kim writes, no freaking way am I sending my kid back to school. A lot of people feel that way at this point, and that's why they're continuing to offer the at-home schooling and the hybrid model of this whole thing. So even though we talked about those 4 counties that are cleared for in-person, they're still supposed to offer something at home as well for people that just aren't ready. Garrett, any other things of note that we didn't get to today? I was trying to think through some of your highlights and lowlights, if you will, in a quick email that you send out to our staff each morning to kind of keep us updated on how
what we didn't get to share yesterday is the new hospital page. So let's just go through that really quick.
Great. Yeah.
Because I remember I tried yesterday and it was not loading.
That's right.
It is loading today. So we'll just share it. They finally they've updated the hospitalization page to reflect sort of this graph that the governor has been put together. We actually put together first. Don't tell that to the governor, but we put it together first.
It looks easier to read, though.
Yeah, and it's much easier to read because now you can see the hospital census, which is the available beds and the occupied beds, along with the COVID-19 numbers. And they can do this because all of these come from the same reporting source. This is all from what's called the EM resource system, and you can see here at the sort of the top of it. And they've recalculated the percentages too. You can see over here at one time, this would have been 90%, 91% for ICU. We're in ICU right now. But you can see at the height on July 13th, 57% of the occupied beds were coming from COVID-19 patients, and the remaining, and about 34%, or excuse me, it looks like it's everything. It's not occupied bed. It's 57% of the entire licensed bed capacity was COVID-19, and then 31% at the time was non-COVID-19 patients. And you can see sort of a flip there now. 55% are from non-COVID patients, and only 23% today are from COVID patients. And then we'll just go to inpatient really quick. Even more starker contrast. You can see at the peak, 45% of licensed beds were taken up by COVID patients versus 41% of non-licensed. And here, or not non-licensed, non-COVID. And then today, only 13%. We're almost at under 1,000 patients in the state for COVID-19 inpatients. We're getting very close to that number. And then 69% of the inpatient hospitalizations are now being taken up by COVID-19 patients or non-COVID-19 patients. This is what we've talked about, that the hospitals are maintaining sort of 80% capacity, and they're getting through these surgeries and some of these other procedures that have been so sorely missed and things that they had to push off because of COVID-19. And so they're maintaining this level right now.
Yeah. I want to get to, and also when we see people back in the hospital able to get procedures that they've been putting off during the heightened time of this pandemic and the heightened time of people in the hospital, that's obviously good news, because that's care that's been either postponed or just put off as much as they can until these numbers subside. So that's obviously good news for others who need to as well.
I see Ryan Rogers is a little suspect of the AZ government's numbers, and that's okay. That's okay.
Is this the Ryan Rogers I know from high school? Ryan, is this you? Let us know if that's you.
And that's okay.
We're happy to help Ryan because there are systems of checks and balances in this to be able to see if the numbers that they are reporting are true. Like, for instance, we wouldn't see this decrease in the number of cases without seeing this decrease in hospitalization a couple of weeks later. So each thing is dependent on each thing. There wouldn't be a way for one number to be grossly falsified that we wouldn't see it reflected other places.
So, and this is what I was going to tell Ryan is while I understand your frustration in the system with these hospitalization numbers, one of the things that I like about these numbers particularly is they're from this system called EM Resource. It's a little hard to see. I was trying to bring it up, but this is the data source for these hospitalizations, and that is a hospitalization bed count tool that the hospital systems themselves input the data directly, and then it just literally gets pulled by the AZDHS and then aggregated into this data via a piece of code. So
Yeah.
they're not really touching the hospitalization data at all. This is just an aggregation. It goes through a piece of code. They put it onto this system, but it's not, there's no one inputting the data on the AZDHS side. This is, again, reporting directly from the hospitals. And that's why I sort of really like these graphs, because it does sort of take out one element of human, the possibility of human error has been removed in these particular graphs. Not fully, because the hospitals still have to enter the data, but, you know, it takes out one layer of that.
Yeah. All right, we're running out of time. I'm sorry, Garrett, to cut you off right there. More good comments. We appreciate all the kind words that you all are leaving. Andrea, I see your comment. Thank you so much. Here's where you can find us, of course, on our newscast coming up at 4, 5, 6, and 10 p.m. and the very latest coronavirus reporting at abc15.com/coronavirus. You can find me over on Facebook at News from Katie, and you can find us both on Twitter. I'm on Twitter at Katie Raml, and Garrett is at Garrett_Archer. We'll see you back here tomorrow, same time, same place.